Have you ever wondered what happens in the brain during those terrifying moments when someone suddenly collapses, can't speak, or can't move one side of their body? What if I told you that every second counts, and that within just a few minutes, parts of their brain may already be dying? This is not just a medical emergency. It's a race against time, a life hanging in the balance. And the scary part, it can happen to anyone at any time without warning. Let's step into the hidden, urgent world of stroke, a silent killer that can steal your future in the blink of an eye. Imagine a bright morning. A father, a mother, a friend, someone just like you or me is getting ready for the day. Everything seems normal until suddenly they stumble, their words become slurred, and one side of their face begins to droop. Their hand goes limp. They try to speak, but nothing comes out. Panic sets in. What's happening? That's a stroke. A stroke, or what doctors call a cerebrovascular accident, is a medical emergency that strikes fast and hits hard. It happens when the blood flow to part of the brain is either blocked or severely reduced, depriving brain tissue of oxygen and vital nutrients. And here's the terrifying truth. Brain cells start to die within minutes. Yes, minutes. Your brain, the organ that controls everything from your heartbeat to your memories to your personality, is incredibly delicate. It relies on a constant, uninterrupted supply of oxygen-rich blood. When that supply is disrupted, whether by a blockage or a bleed, the clock starts ticking. This is what makes stroke one of the most dangerous and deadly medical conditions known today. Without immediate treatment, the damage becomes permanent. And in the worst cases, it can lead to death, often within hours. You see, unlike some other parts of the body, the brain doesn't store oxygen, doesn't store nutrients, depends completely on continuous blood flow. So when that flow is interrupted, even for a short while, things start to fall apart fast. Every passing moment means more brain tissue lost, more functions gone, more of the person you know or are slipping away. It's not dramatic to say this. Stroke kills fast, and it disables even faster. And yet, the tragedy is not just in how dangerous it is, but how little people know about it. How quickly it can strike, and how crucial those first minutes really are. Let's dig deeper. What's actually going on during a stroke? There are two main ways this nightmare unfolds. In the most common type, called ischemic stroke, something blocks the blood flow. Usually it's a clot that forms in or travels to the arteries supplying the brain. Like a dam in a river, this blockage causes a backup, and the oxygen simply can't get through. The result is starvation. Brain cells, deprived of oxygen, start dying off. This type accounts for nearly 80% of all strokes. The second type is rarer but often more severe. A hemorrhagic stroke. Here, instead of a blockage, a blood vessel bursts, often due to high blood pressure or a weakened artery wall. The brain doesn't just lose blood flow. It gets flooded with blood where it shouldn't be, causing severe pressure and rapid damage to surrounding tissues. In both cases, the outcome is the same: brain damage, disability, or death, unless help comes fast. This is why doctors talk about the golden hour, or the critical window, the first 4.5 hours from the onset of symptoms. During this time, quick treatment can save brain tissue, reverse the damage, and dramatically increase the chances of survival and recovery. But here's the catch. Most people don't recognize a stroke when it happens. They think it's fatigue, stress, pinched nerve. They wait. They try to sleep it off. And that delay can cost them their life or leave them with lifelong disability. So next time you see someone struggling to speak, with a drooping face or a weak arm, don't hesitate. Call emergency services immediately. Because when it comes to stroke, every second is brain lost. This isn't just a story about biology. It's about human life. Our memories, our families, our future. Stroke doesn't knock. It doesn't wait. It comes without warning, and it doesn't care who you are. But if we recognize it early, act fast, and spread awareness, we can beat it. You now know what a stroke really is. The question is, will you be ready when it matters most? What if, in the middle of an ordinary day, something invisible inside your body suddenly turned against you? One moment you're fine, talking, walking, laughing, and the next a hidden force begins to steal your speech, your strength, maybe even your life. This is the terrifying reality of stroke. It doesn't always come with warning signs, and when it strikes fast. And knowing what kind of stroke is happening could mean the difference between recovery and a lifetime of struggle. Most people don't realize there are different types of stroke. And understanding these types isn't just medical knowledge, it's critical for survival. Let's explore the two faces of stroke, each dangerous in its own way, but completely different in how they unfold. The first, and by far the most common, is called ischemic stroke. This type accounts for nearly 80% of all stroke cases. That means 4 out of every 5 strokes are caused not by something bursting, but by something blocking the blood flow to the brain. Picture this. A blood clot forms in one of your arteries. Maybe it's the result of high cholesterol, an irregular heartbeat like atrial fibrillation, or plaque buildup over the years. That clot begins to move, drifting silently through your bloodstream. Then it lodges in a narrow vessel inside your brain. Suddenly, like a city cut off from its power supply, a region of your brain is starved of oxygen and nutrients. The cells in that area, the very neurons that control speech, movement, memory, begin to suffocate. They start to die. Within minutes. This is an ischemic stroke, a blockage. Quiet, stealthy, but devastating. The damage spreads with every second that blood flow is stopped. The longer the clot stays lodged, the more of you is at risk of being lost forever. And yet, if it's caught early enough, this type of stroke can often be reversed. With powerful medications called clot busters, or mechanical procedures to physically remove the clot, doctors can sometimes restore blood flow before permanent damage is done. But time is everything. If you wait too long, the window closes, and the damage becomes irreversible. Now imagine a very different scenario. This time the threat isn't a blockage. It's a burst. This is the second type of stroke, hemorrhagic stroke. And though less common, it's often far more deadly. In a hemorrhagic stroke, a blood vessel inside the brain suddenly ruptures. The cause could be high blood pressure that's gone untreated for years. It could be a weakened blood vessel wall, a ticking time bomb. Or it might be an abnormal tangle of vessels, something you never knew you had until the moment it fails. When that vessel bursts, blood pours into the surrounding brain tissue. Not only does this disrupt the flow of oxygen, but the blood itself puts pressure on nearby neurons, causing damage fast and furiously. Imagine your brain, a soft, delicate organ, suddenly being compressed from within by rising pressure, as more and more blood fills a space it was never meant to be in. Unlike the slow suffocation of an ischemic stroke, this is an explosion, a flood. And it's chaos. Patients often describe the beginning of a hemorrhagic stroke as the worst headache of their life. Comes on suddenly, violently. It may be accompanied by vomiting, confusion, seizures, or loss of consciousness. The outcome can be fatal, and even when it's not, survivors often face severe long-term disabilities. Because of the bleeding, doctors have to act very differently than they would in an ischemic stroke. Giving a clot-busting drug, which would help in a blockage, would be deadly here. In fact, one of the first things emergency doctors must do is determine which type of stroke has occurred, often using a CT scan. That's why it's so crucial to get the patient to a hospital right away. Because without knowing whether it's a blockage or a bleed, no one can safely begin treatment. Both types of stroke, though different in nature, have one thing in common. They are emergencies. Life-threatening, time-sensitive emergencies that require immediate attention. The tragedy is, most people don't know which type exists, or even that there are different types. And that lack of awareness can cost lives. So here's what we need to remember. If you or someone around you suddenly has trouble speaking, numbness in the face or limbs, especially on one side, or loses balance or vision, don't wait. Don't guess. Call emergency services immediately. Let the professionals do what they're trained to do. Get to the hospital. Get scanned. Get diagnosed. Because if it's an ischemic stroke, they may be able to stop it in its tracks. And if it's hemorrhagic, they'll know how to stabilize the bleeding and reduce the pressure. Stroke is not a single enemy. It's two entirely different battles. One where the blood flow is blocked, the other where it explodes. And in both cases, time is brain. The faster you act, the better the chances of saving not just a life but a future. So now that you know the two faces of stroke, the silent clot and the sudden burst, you're one step closer to being prepared. Will you know what to do when every second counts? Start subtly. A strange sensation in your hand. A slight numbness crawling across your cheek. You try to speak, but the words feel stuck, twisted, wrong. You look into the mirror and your smile doesn't quite match. One side droops. You feel dizzy, disoriented, maybe even nauseous. And then comes the headache. Sharp, sudden, and overwhelming. What would you do? Would you recognize what's happening? Would you know that every second that passes could mean the difference between life and death, between full recovery and permanent disability? These are not just random symptoms. They are the brain's cry for help. They are the warning signs of a stroke, a silent, swift, and often deadly emergency. Most people imagine stroke as something that hits without warning, a sudden collapse. But in many cases, the body does give you signs, clear, physical clues that something is deeply wrong. You just have to know what to look for. So let's break down the major symptoms, one by one. Not to scare you, but to prepare you. Because being able to spot these red flags can save a life. Maybe even your own. The first and most common sign is numbness or weakness in the face, arm, or leg. This often happens on one side of the body only. It may begin as a tingling feeling, or a sensation like your limb has fallen asleep. Then, quickly, it turns to weakness. You might not be able to lift your arm or walk without stumbling. Your face might droop. You might try to smile and find only half your mouth responds. This isn't fatigue. It's not stress. It's not something to sleep off. It's your brain telling you it's losing power. Next is trouble speaking. The words are there in your mind, but they won't come out clearly. You try to talk and instead you slur. You mumble. You speak nonsense or can't find the words at all. This is one of the most terrifying symptoms. Knowing what you want to say but being unable to say it. And for the people around you, it's often the first unmistakable sign that something is very wrong. And then there's the mouth. You may not feel it yourself, but others will notice. Your mouth might suddenly twist to one side. It may look uneven, distorted, as if you're grimacing even when you're not trying to. This facial asymmetry is a key signal that one side of the brain is no longer communicating properly with your muscles. Vision changes are another warning sign. Suddenly, the world around you doesn't look quite right. You might lose sight in one eye or both. Things could appear blurry, or your visual field may feel like it has holes, as if you're looking through a tunnel or a foggy window. Some people describe it as dark patches or dimness creeping in from the edges. If your sight suddenly shifts like this, don't wait. Could be your brain losing control over your eyes. Then there's the headache. Not just any headache, but a sudden, severe, and unfamiliar one. A pain that feels like an explosion inside your skull. It can hit without warning and may be accompanied by vomiting, dizziness, or even loss of consciousness. This symptom is more often associated with hemorrhagic stroke, the type caused by a ruptured blood vessel in the brain. But regardless of the cause, this kind of pain should never be ignored. And speaking of dizziness, another red flag is loss of balance or coordination. You might feel like the room is spinning even though you're standing still. You try to walk and your legs betray you. Simple tasks like reaching for a glass or standing up become impossible. The stroke is affecting the part of the brain that controls movement, balance, and spatial awareness. All these symptoms can appear alone, or in combination. They can come on gradually or all at once. But one thing is always true, they should never be ignored. Here's the most important truth. Every second counts. When brain cells are deprived of oxygen, they begin to die within minutes. The longer you wait, the more damage is done. That's why doctors often talk about the golden window of treatment, the first 4.5 hours from symptom onset, where life-saving drugs and procedures can be most effective. But that window slams shut fast. And once it's closed, the damage can be permanent. So what can you do? If you ever experience or witness any of these symptoms, don't hesitate. Call emergency services immediately. Don't drive yourself. Don't lie down to rest. Don't try to shake it off. Get to a hospital where specialists can run the necessary scans, determine the type of stroke, and begin urgent treatment. There's a simple way to remember the signs. It's called be fast. Balance. Sudden loss of coordination. Is vision changes or loss. Face. Uneven smile or drooping. Arms. Weakness or numbness. Speech. Slurred or strange speech. Time. Act immediately. Time is brain. Stroke doesn't discriminate. It can happen to anyone, young or old, healthy or ill. But with awareness, education, and quick action, we can turn fear into focus and turn tragedy into survival. The warning signs are there. The only question is, will you recognize them in time? Imagine waking up one morning, your eyes open, your mind alert, but your body refuses to respond. You try to move your hand, but it lies still. You attempt to speak, but no sound comes out. The words are there in your brain, but your mouth no longer remembers how to shape them. This is not a nightmare. For millions of people around the world, this is life after stroke. When we talk about stroke, we often focus on the emergency, the sudden collapse, the rush to the hospital, the golden window of time. But what happens after the crisis? What does life look like for those who survive? The truth is, a stroke doesn't always end when the bleeding stops or the clot is removed. In many cases, it leaves behind a trail of devastation that affects nearly every part of a person's life, physically, mentally, and emotionally. One of the most heartbreaking consequences of stroke is disability. Depending on how long the brain was deprived of oxygen and which part of the brain was affected, stroke survivors may experience permanent or temporary paralysis. This often shows up as weakness or loss of control on one side of the body. A once independent person may suddenly need assistance to walk, eat, or even sit upright. Some must relearn how to perform the most basic tasks, brushing their teeth, using the bathroom, or getting dressed. But the damage isn't just physical. One of the most profound and often overlooked impacts of stroke is the loss of communication skills. Many survivors struggle with speaking, understanding speech, reading, or writing. The medical term is aphasia, but to the person living with it, it feels like being trapped in silence. They know what they want to say but can't express it. Words get stuck. Sentences come out jumbled. The frustration can be overwhelming, for them and for their loved ones. Others lose the ability to swallow properly. It sounds simple, but swallowing involves a complex coordination of muscles, nerves, and timing. When the stroke affects those areas, eating becomes dangerous. A small sip of water can go down the wrong pipe and cause choking or aspiration pneumonia. Eating and drinking, two of the most basic joys of life, become medical risks. Then there's memory and cognition. Many stroke survivors report a fog that descends after the event. They forget names, dates, appointments. They may have trouble concentrating, solving problems, or making decisions. It's like their brain has short-circuited, leaving gaps they can't quite fill. These cognitive changes can rob people of their independence, their confidence, and their connection to the world around them. And as if that weren't enough, the psychological impact of stroke can be just as crushing. It's not uncommon for survivors to experience emotional instability, frequent crying or anger, or an inability to control their feelings. But the most common and devastating emotional consequence is depression. Imagine losing control of your body, your voice, your mind, and then being expected to stay positive and hopeful. Depression after stroke is not just understandable, it's almost inevitable. People feel isolated, afraid, and uncertain about their future. The hobbies they once loved become out of reach. The friendships they once relied on may fade. Without support, it's easy to fall into a deep emotional darkness. This is why stroke is not just a medical emergency. It's a life-altering event that changes everything. And not just for the person who suffers it, but for their family, friends, and caregivers. A spouse becomes a nurse. Child becomes a guardian. Roles shift. Relationships are tested. Routines are broken and rebuilt. It is a long, difficult road that requires patience, resilience, and above all, understanding. But there is hope. With early rehabilitation, therapy, and a strong support system, many stroke survivors regain significant function. Physical therapy helps restore movement. Speech therapy rebuilds communication. Occupational therapy teaches people how to navigate daily life again. Mental health counseling provides tools to cope with depression and anxiety. The recovery may be slow, but with each small step forward, a new version of life begins to emerge. Still, the key lies in awareness and action. Understanding the lasting impact of stroke helps us take it more seriously. Not just when it happens, but in the way we support survivors afterward. We need to see beyond the wheelchair or the slurred speech and recognize the fierce battles people are fighting every day just to live a life that once felt ordinary. So next time you hear the word stroke, don't just think of an emergency. Think of a journey, a recovery, a fight to regain what was lost. And if you or someone you love is walking that path, remember this: you are not alone. Together, with knowledge, compassion, and timely care, we can not only survive stroke but rise beyond it. What if your brain was being silently attacked, and you didn't even know it? No warning signs, no sudden collapse, no slurred speech or numb limbs. Just a quiet thief, slowly damaging your most vital organ without making a sound. This is the terrifying reality of what doctors call a silent stroke. It doesn't look or feel like the dramatic emergencies we often associate with stroke. There's no headline moment, no ambulance sirens wailing. But make no mistake, silent strokes are real and they are dangerous. A silent stroke occurs when a small part of the brain stops receiving blood. A clot, a tiny bleed, or even damage to the smallest vessels in your brain causes this disruption. And yet, in most cases, the person has no idea it's even happening. No pain, no paralysis, no obvious symptoms. Life goes on as usual, at least on the surface. But inside the brain, the story is very different. Neurons die. Brain tissue becomes scarred. Communication between regions weakens. The brain silently loses function, one cell at a time. And by the time it's detected, the damage has already been done. So how do we find it? Often, silent strokes are discovered completely by accident. A patient might be undergoing a brain scan, a CT or MRI, for an unrelated reason. Maybe it's for a headache or dizziness or memory problems. And then the radiologist sees it. Small dark spot, a sign of tissue death. A mark left behind by a stroke the patient never felt. This discovery is both shocking and sobering. Because while the person may have felt nothing at the time, that tiny stroke may already be affecting how they think, move, or remember. It's like discovering that a building has a cracked foundation, even though the walls still stand. Silent strokes typically come in three forms. The first is what we call silent cerebral infarctions. These are small, localized areas of brain tissue that die due to a lack of blood flow, much like in a traditional ischemic stroke, but without the obvious symptoms. Then there's white matter disease, which refers to subtle damage to the brain's wiring, the areas that allow different parts of the brain to communicate. And finally, there are cerebral microbleeds, tiny spots where blood has leaked into the brain, often too small to cause immediate symptoms, but large enough to leave a permanent mark. Each of these forms represents a quiet insult to the brain. And while one event may not be noticeable, over time, multiple silent strokes can have a cumulative effect. Memory starts to slip. Focus becomes harder. Emotions feel harder to control. Tasks that once felt easy now require more effort. Eventually, some people may develop vascular dementia, a type of cognitive decline caused by impaired blood flow in the brain. Who is most at risk? Silent strokes can happen to anyone, but the risk increases significantly with age. As the brain's blood vessels weaken or narrow over time, the likelihood of these small blockages or bleeds rises. Women, in particular, appear to be at greater risk, especially after menopause when hormonal changes affect vascular health. And anyone with high blood pressure, diabetes, high cholesterol, or a history of smoking is walking on thinner ice. The problem is that, without obvious symptoms, silent strokes often go untreated. People don't get the therapy they need. They don't adjust their lifestyles. They don't take steps to protect their brains, because they don't know there's something wrong. But awareness can change that. By recognizing the silent nature of these strokes, we can start to look more closely at the subtle warning signs. Repeated memory lapses, personality changes, a sudden drop in focus or problem-solving ability, unexplained clumsiness or dizziness. These aren't just signs of aging. Sometimes, they're quiet cries for help from a brain that's been hurt more than we realize. And if a brain scan does reveal a silent stroke, it's not too late. That discovery can be a turning point. It's a wake-up call to take control of your health. Lower your blood pressure. Manage your blood sugar. Quit smoking. Exercise regularly. Eat a diet rich in vegetables, whole grains, and healthy fats. Take your medications seriously. These steps won't undo the damage, but they can prevent further harm. Silent strokes remind us of something important. Not all threats announce themselves with noise and drama. Sometimes the most dangerous things are the ones we can't see or feel. And yet they're just as real. So if you've never heard of a silent stroke before today, now you have. And that knowledge could change everything. Because the best protection is awareness. The best chance at recovery is early action. And the strongest defense we have is information. Every 3 seconds, someone in the world suffers a stroke. While you're watching this video, someone's life is being changed forever. A family is holding its breath. A person is fighting for survival. And time, precious, irreversible time, is slipping away. This is the reality of stroke. It doesn't just happen somewhere far away or to someone else. It's happening now, possibly to someone you love or even to you, and you don't yet know it. Let that number sink in. Every 3 seconds, another stroke. That's 20 strokes every minute. Over 28,000 strokes every single day. Globally, this adds up to millions of lives impacted every year. It's not just a statistic. It's a human story repeated over and over again in every country, in every language, across every age group. In Vietnam alone, the incidence of new strokes has reached 161 out of every 100,000 people. It's a growing crisis, not just among the elderly, but increasingly among middle-aged and even younger adults. The fast-paced lifestyles, poor diets, stress, and lack of regular health checkups are all contributing to this alarming rise. And yet, amidst these sobering numbers, there is a beacon of hope. It's called the Golden Hour. The Golden Hour isn't just a poetic phrase. In the world of emergency medicine, it's a lifeline. For stroke, the critical window is 4.5 hours from the moment symptoms first appear. Within this time frame, the chances of reversing brain damage, preserving quality of life, and even saving lives increase dramatically. During this golden window, certain treatments can be administered that break up clots, restore blood flow to the brain, and minimize permanent damage. One of these is thrombolytic therapy, a medication that can dissolve the clot causing an ischemic stroke. But it only works if given early. If time is lost, so is brain function. There is a saying among stroke doctors: time is brain. For every minute that a stroke goes untreated, nearly 2 million neurons can die. That's 2 million connections, memories, abilities, and pieces of a person's identity. The longer the delay, the greater the damage, and the harder the recovery. That's why recognizing the signs early and acting fast isn't just important, it's critical. Knowing what to look for can make the difference between life and death, between independence and lifelong disability. Think about how quickly 4.5 hours can pass. A long lunch, an afternoon nap, a few episodes of your favorite show. It's not much. But in stroke care, it's everything. If a stroke patient gets to the hospital within this golden window, their odds of recovery improve significantly. In fact, some patients who receive treatment in time can walk out of the hospital days later, with little or no permanent disability. But if that time is wasted, if the signs are ignored, misinterpreted, or brushed off, then the chance for recovery slips away. The golden hour becomes a missed opportunity. Tragic, what? So how do we make sure we don't miss it? Education is the first step. We must all become familiar with the signs of stroke: sudden numbness or weakness, especially on one side of the body, confusion or difficulty speaking, trouble seeing, sudden dizziness or loss of balance, or a severe, unexplained headache. If even one of these symptoms appears, call emergency services immediately. Don't wait. Don't assume it will pass. Don't drive yourself. Time matters. Next, we must have a plan. Know the nearest stroke-ready hospital. Have your medical records accessible. Keep a list of your medications and allergies. Make sure your family knows what to do. Because when the clock starts ticking, panic and confusion can cost you precious minutes. Finally, we must understand that stroke is not the end. With quick treatment and proper care, many people recover fully. Some go on to live rich, meaningful lives. But it all starts with one decision: to act quickly. The statistics may seem overwhelming, even frightening. And they should be. Stroke is one of the leading causes of death and disability worldwide. But hidden within those numbers is a powerful truth. Stroke is also one of the most treatable emergencies, if caught in time. So the next time you hear someone slurring their speech, or see them struggling to lift an arm, don't wait. Don't hesitate. Remember that every minute counts. Every second matters. And maybe, just maybe, you'll be the reason someone survives. The reason they get another chance. The reason the story doesn't end. Because in the fight against stroke, time is the most valuable thing we have. And the golden hour is our greatest hope. Imagine this. You're standing in the kitchen with a loved one when suddenly, they start slurring their words. One side of their face droops. They try to lift their arm, but it won't respond. You feel a wave of panic. Your heart races, your mind goes blank. What do you do? In moments like this, what you do next could mean the difference between recovery and permanent disability. Between life and death. The minutes following a stroke are some of the most critical in a person's life. And the truth is, many people don't know what to do when it happens. But you can be the difference if you're prepared. The very first thing to do is stay calm. Panic wastes time. Focused action saves it. Start by taking mental notes, clear, specific, and fast. Pay attention to the symptoms you observe. Is there facial drooping? Arm weakness? Speech difficulties? Make a note of exactly when the symptoms began. If you don't know the exact moment, try to estimate as best you can. The timing is essential because many life-saving stroke treatments can only be given within a certain window after onset. Also, if the person has a known history of stroke, high blood pressure, diabetes, heart conditions, or any neurological issues, keep that in mind. Matters. If they're on medication, particularly blood thinners or treatments for chronic illnesses, this information needs to be communicated to the emergency medical team when they arrive. Next, gently assist the person into a safe and comfortable position. Do not let them move around or try to walk, especially if they've collapsed or fallen. Moving a stroke victim without guidance can make things worse. Instead, help them lie on their side. This can prevent choking in case of vomiting and also keeps the airway open. Elevate the head slightly with a pillow or folded cloth. Make sure the environment is calm and safe. Loosen any tight or restrictive clothing, especially around the neck and chest. This helps them breathe more easily and reduces any unnecessary discomfort. But just as important as knowing what to do is knowing what not to do. In a desperate attempt to help, some people turn to old wives' tales or unproven home remedies. You might hear someone say to prick the fingers or ears to let out bad blood, or to try to bring the person back to consciousness using vinegar, oils, or pinching. Please don't do any of that. These methods are not only ineffective but can be dangerous. They delay real medical care. They risk infection or injury. And they waste precious seconds. Seconds that could be used to call for help and prepare for the arrival of medical professionals. Under no circumstances should you try to give the person food, drink, or medicine. They may have difficulty swallowing, which could cause choking. Even if they appear alert, the safest action is to withhold anything by mouth until evaluated by professionals. The only thing you should be doing in this moment is calling emergency services immediately. While you wait, stay by the person's side. Talk to them calmly. Let them know help is on the way. Your voice may be the anchor they need during a terrifying and disorienting experience. If you're in a public place, alert those nearby to your situation. Someone may be trained in basic emergency care or can help direct the ambulance quickly when it arrives. Once emergency responders arrive, give them all the details you've collected. The symptoms you observed, the time they began, any medical history, current medications, and what care you've already provided. This kind of information can guide doctors toward faster, more accurate treatment. And after the emergency, care doesn't stop. Stroke recovery often involves a long road of physical therapy, speech training, and emotional support. Your role as a caregiver or loved one is crucial in this phase too. Patience, encouragement, and consistency help rebuild what the stroke tried to take away. But the first step, those first minutes, that's where everything begins. That's when you become the first responder. You don't need medical training to save a life. You just need to be prepared, stay calm, and act quickly. So ask yourself, if a stroke happened in front of you right now, would you know what to do? Now you do. And that knowledge might one day save someone you love. Maybe even yourself. Time is brain. And in your hands, in those first few moments, lies the power to protect it. Have you ever noticed how some people seem completely fine one day, then suddenly collapse the next without warning? A normal morning turns into an emergency. A quiet night ends in a hospital. For many stroke survivors, it wasn't something dramatic that triggered the episode. It was something simple. Cold shower late at night. A quick step outside into the chill of early dawn. A sudden movement after waking up. Small things. Everyday things. But sometimes, these tiny choices can lead to life-altering consequences. The good news is that many strokes are preventable. And prevention isn't always about medications or medical equipment. Sometimes it's about daily habits, paying close attention to what we often dismiss as harmless. Let's start with something most people never question. Showering. It's a basic part of our daily routine. But did you know that bathing late at night, especially when your body is tired and the environment is cold, can be dangerous for people at risk of stroke? When you step into a cold bathroom or take a shower during chilly weather, your blood vessels constrict. If your blood pressure is already unstable or you have underlying cardiovascular conditions, this sudden constriction can become a trigger. The body's temperature drops, circulation slows, and the risk of a stroke quietly rises. That's why it's crucial to avoid showering late at night or in cold conditions. Instead, bathe earlier in the evening when your body is still warm, and make sure the room is comfortably heated. If the air is cold, delay the bath. Your safety matters more than your schedule. And it's not just bathing that can be risky. Stepping outside during the early hours of the morning can also pose serious dangers. Between 4 and 5 a.m., temperatures are often at their lowest, and your body, just waking from a resting state, is more vulnerable to sudden changes in temperature and blood pressure. If you must go out early, whether for exercise or work, make sure you are properly dressed and give your body time to adjust. Do a light warm-up indoors. Drink something warm if the weather is cold. Let your body ease into the day, rather than shock it into wakefulness. Speaking of temperature, there's another overlooked moment of risk that hides in plain sight, right after a warm shower. Imagine you've just finished bathing on a cold winter night. Your skin is still damp, steam lingers in the air, and without thinking, you open the bathroom door and step into a much colder room. The temperature shift hits your body instantly. That sudden drop can cause your blood pressure to spike or crash, triggering dizziness, imbalance, or worse, a stroke. Always take a moment before leaving the bathroom in winter. Dry off thoroughly, wear warm clothing, and make sure the next room isn't freezing cold. A few extra minutes of caution could save you from days, months, or even years of recovery. One of the most surprising risks often happens first thing in the morning, before your feet even hit the floor. You wake up, stretch, and suddenly stand up too quickly. In that one motion, your blood pressure might drop sharply, leading to dizziness, fainting, or even triggering a stroke in individuals with underlying conditions. The solution is simple but often forgotten. Move slowly. When you wake, open your eyes and sit up gradually. Let your body adjust. Sit on the edge of the bed for a few moments before standing. These gentle transitions give your heart and brain time to balance blood flow, reducing the risk of a sudden pressure drop. While all of this may sound overly cautious, it's important to remember that stroke doesn't care if you're busy, if you're in a rush, or if you think you're too healthy for it to happen to you. It strikes when the conditions allow. And the most heartbreaking part is that many strokes could have been prevented with just a bit more awareness. Taking simple actions, avoiding cold showers late at night, dressing warmly in cold environments, giving your body time to adjust after sleep, can significantly reduce your risk. These are habits you can start today, without waiting for a diagnosis or a warning sign. Because by the time symptoms show up, the damage may already be done. Prevention begins long before crisis. Begins with knowledge, with awareness, with small changes in your everyday life that keep your brain protected, your heart supported, and your future intact. So take a moment to look at your daily routine. Think about those cold mornings, those rushed wake-ups, those late-night showers. Could a simple shift in your habits keep you safe from something devastating? The answer is yes. And now you know how. It begins silently, sometimes without a warning. A missed word, a stumble in the hallway, a hand that won't lift, a smile that droops. In the blink of an eye, everything can change. One moment you're fine, the next you're in a hospital bed, fighting to speak, to move, to remember who you are. That's the devastating power of stroke. But here's something even more powerful: knowledge, awareness, and action. Over the past chapters of this story, we've journeyed through the many faces of stroke. From what it is, how it strikes, the terrifying symptoms, the hidden dangers, and the lasting damage it can leave behind. We've learned about the two major types: ischemic stroke caused by a blocked artery, and hemorrhagic stroke caused by bleeding in the brain. We've seen how time is everything, that golden 4.5-hour window that can mean the difference between full recovery and a lifetime of struggle. We've recognized the red flags: the slurred speech, the sudden numbness, the blurred vision, the crushing headache, the unexpected fall. And we've seen that stroke doesn't always shout. Sometimes it whispers. Silent strokes, though lacking dramatic symptoms, still destroy brain tissue, still rob us of memory, balance, and clarity. And often we don't even know it's happened until it's too late. We've witnessed the aftermath: lives reshape, words forgotten, limbs that no longer respond. A loved one who can no longer recognize your face, who smiles but doesn't speak. And in those quiet rooms, recovery can feel like a mountain with no summit. Lonely, exhausting, and painfully slow. The emotional scars are as deep as the physical ones. Depression often walks hand in hand with healing. But there is hope. In every statistic there is a name. In every diagnosis, a story. In every moment of awareness, a chance to protect ourselves and those we love. That's why knowing how to respond is vital. When stroke strikes, every second counts. That's why recording the time symptoms began, keeping the patient still and comfortable, resisting the urge to use old folk remedies. These steps save lives. They build bridges to recovery. They buy us time when time is the most precious thing we have. And long before that moment of crisis, there's something even more powerful: prevention. Prevention that begins not with medication but with mindfulness. Not just in the hospital but in the bathroom, in the bedroom, in the chill of early morning air. We've learned how simple habits, avoiding cold showers at night, dressing warmly in winter, standing up slowly in the morning, can become shields that protect us from harm. These may seem like small adjustments, but they are acts of self-respect, of awareness, of love for our future selves. You see, stroke doesn't care about status, age, or gender, but it does listen to how we treat our bodies. Pays attention to the moments we ignore. It watches when we dismiss our symptoms, push through pain, or say, "It's nothing." So we have to care even louder. We have to listen more closely. Because what's at stake is everything. Your ability to smile, to hug your child, call your best friend, to finish the sentence you started, to dance again, to live your life on your own terms. These are not small things. They are the essence of who we are. And they are worth protecting at all costs. This is more than a health lesson. This is a call to wake up, to see the unseen, to notice the quiet signs and take them seriously, to treat our everyday routines as the front line of prevention, to not wait until we or someone we love is lying in a hospital bed, wishing we had known more. So let's not be silent about stroke. Let's not keep this knowledge to ourselves. Share what you've learned. Start conversations with your family, your friends, your community. Let this be the beginning of a movement, not of fear, but of strength and preparation. Because stroke steals in silence, but awareness speaks volumes. And if this story has touched you, if it's opened your eyes, stirred your heart, or made you pause even for a moment, then we ask you from the bottom of our hearts to share it. Help us spread this message to as many people as possible. Because every view, every share, every comment could be a life saved. And don't forget to subscribe to our channel Golden Wellbeing for more inspiring, life-changing content like this. Together we can rewrite the ending. Together we can make stroke something we no longer fear, but something we fight, prevent, and rise above. Thank you for being here. Thank you for caring. And thank you for believing that knowledge is power, and that every life is worth protecting.